What if I told you your liver starts recovering within just 24 hours after your last drink? Or that your sleep quality could dramatically improve within a week? The journey of quitting alcohol transforms your body in ways most people never realize, and some of these changes might surprise even the most seasoned health experts. In this video, I'm breaking down exactly what happens to your body, day by day, week by week, when you finally put down that glass for good. When you stop consuming alcohol, your body undergoes a remarkable series of positive changes that affect virtually every organ system. These transformations begin within hours of your last drink and continue to develop over weeks and months of sobriety. The recovery timeline varies among individuals based on factors such as drinking history, overall health, and genetics, but the potential health benefits are substantial for anyone who reduces or eliminates alcohol consumption. The withdrawal phase, the first 72 hours. The initial phase after quitting alcohol is often characterized by withdrawal symptoms, which signal that your body is beginning its recovery process. Within the first 24 hours after stopping alcohol, many people experience mild withdrawal symptoms, including anxiety, hand tremors, sweating, and headaches, as the body adjusts to functioning without alcohol. For some individuals, alcohol cravings become more intense during this period, often accompanied by feelings of fatigue and depression. Between 12 and 72 hours after the last drink, some individuals may experience more severe withdrawal symptoms. In rare cases, particularly for heavy drinkers, this period may involve the development of delirium tremens, DTs, which can include seizures, hallucinations, and significant increases in heart rate and blood pressure. The risk of seizures is typically highest between 24 to 48 hours after the last drink, requiring careful monitoring and potentially medical intervention. After approximately 48 to 72 hours, withdrawal symptoms begin to subside for most people, allowing for improved functioning and symptom management. However, some individuals may continue to experience more persistent withdrawal-related symptoms such as sleep disturbances, fatigue, and mood changes that can last for months, though this is relatively uncommon. It's worth noting that the severity of withdrawal symptoms largely depends on factors like the duration and quantity of previous alcohol consumption. One of the most significant benefits of alcohol abstinence is the positive effect on cardiovascular health. Research has demonstrated that after 1 month of complete abstinence from alcohol, blood pressure decreases substantially. A clinical study involving heavy alcohol drinkers showed an average reduction of 7.2 mm Hg for systolic blood pressure and 6.6 mm Hg for diastolic blood pressure after just 1 month of proven alcohol abstinence. This reduction is clinically meaningful, as the proportion of alcoholic patients classified as hypertensive, based on 24-hour blood pressure criteria, decreased from 42% during alcohol consumption to only 12% after 1 month of complete abstinence. Beyond blood pressure, resting heart rate also improves with sobriety. One case study documented an individual whose average sleeping heart rate dropped from 65 beats per minute to 56 beats per minute after 5 months of abstinence. Similarly, heart rate variability, HRV, which is an important indicator of cardiovascular health, improved from an average of 55 milliseconds to 67 milliseconds. Higher HRV is associated with better cardiovascular health and adaptability to stress. These cardiovascular improvements occur because alcohol has direct toxic effects on heart muscle cells and disrupts the normal regulation of blood vessel constriction and dilation. When alcohol consumption stops, the cardiovascular system begins to recover from this chronic stress, resulting in more efficient heart function and normalized blood pressure. The liver, one of the organs most profoundly affected by alcohol consumption, demonstrates remarkable regenerative abilities when given the opportunity to heal. Because of the liver's unique capacity for self-repair, giving up or reducing alcohol consumption can help this vital organ heal itself and resume proper functioning. For individuals with fatty liver disease, a common early consequence of excessive alcohol consumption, this regeneration can happen surprisingly quickly within just 2 to 3 weeks after giving up alcohol. This rapid recovery demonstrates the liver's resilience when the toxic burden of alcohol is removed. The liver plays crucial roles in over 500 bodily functions, including filtering toxins from the blood, metabolizing nutrients, producing essential proteins, and regulating blood sugar. As it recovers from alcohol-induced damage, these functions gradually normalize, contributing to overall improvements in energy, digestion, immunity, and metabolic health. Even for individuals with more advanced liver damage, abstinence from alcohol is the most important step toward halting disease progression and allowing whatever recovery is possible. The brain demonstrates impressive resilience and recovery abilities following alcohol cessation thanks to neuroplasticity, the brain's ability to reorganize itself and form new neural connections. When alcohol consumption stops, the brain begins repairing damaged neural pathways, and this recovery becomes noticeable within weeks of abstinence. One of the most significant improvements occurs in cognitive function. Alcohol impairs various cognitive processes, including memory formation, concentration, and problem-solving abilities. With abstinence, these cognitive deficits gradually improve, leading to enhanced mental clarity and focus. Many people report feeling as though they've emerged from a mental fog after a period of sobriety. The recovery process involves both the repair of existing neural connections and, remarkably, the generation of new neurons, neurogenesis. Research has shown that neurogenesis can occur even in adulthood, allowing the brain to produce new cells to replace those damaged by alcohol. Additionally, the balance of neurotransmitters, chemical messengers that regulate mood, cognition, and various bodily functions, gradually normalizes with abstinence, which helps reduce anxiety and mood swings often associated with alcohol use. While individual experiences vary based on factors such as the severity and duration of alcohol consumption, most people experience meaningful improvements in brain function with sustained sobriety. Professional support through treatment programs and therapy can significantly enhance this recovery process. Alcohol's dehydrating effects and impact on inflammation visibly manifest in skin appearance, and quitting drinking leads to noticeable improvements in skin health and aesthetics. Within just 1 week of abstaining from alcohol, many people begin to experience positive changes in their skin's appearance and health as hydration levels improve. Hydrated skin appears plumper, smoother, and healthier. Many drinkers experience facial redness and flushing due to alcohol's dilation of blood vessels near the skin's surface. After a week without alcohol, this characteristic redness begins to diminish, resulting in a more even complexion. The benefits continue to accumulate with sustained sobriety. After 1 month of abstinence, overall complexion typically becomes brighter and more radiant as skin hydration improves and blood circulation normalizes. Facial puffiness and bloating, particularly around the eyes, common side effects of alcohol's inflammatory response, noticeably decrease, lending the face a more youthful and refreshed appearance. After approximately 3 months without alcohol, more significant transformations occur. Many people notice a reduction in acne and breakouts, as alcohol can exacerbate skin issues by disrupting hormonal balance and increasing inflammation. Fine lines and wrinkles may appear less pronounced due to improved skin elasticity and hydration levels. The cumulative effect is skin that looks healthier, more vibrant, and less tired, contributing to an overall more youthful glow. Alcohol significantly disrupts sleep architecture, despite its initial sedative effects, and quitting drinking leads to substantial improvements in sleep quality and daytime energy levels. While alcohol might help some people fall asleep faster, it prevents them from reaching the deeper, more restorative stages of sleep necessary for true rest and recovery. Within approximately 2 weeks of abstinence, many individuals begin noticing improvements in their sleep patterns. They report finding it easier both to fall asleep naturally and to remain asleep throughout the night. Perhaps most importantly, they describe feeling genuinely more rested upon waking, with increased daytime energy and alertness. These subjective improvements are supported by objective measurements. One case study documented meaningful changes in sleep metrics after 5 months of sobriety, including a lower sleeping heart rate, decreasing from an average of 65 beats per minute to 56 beats per minute, and improved heart rate variability, increasing from an average of 55 milliseconds to 67 milliseconds. These metrics not only indicate better sleep quality, but also reflect improved overall health and fitness. Better sleep catalyzes numerous additional benefits, creating a positive cascade effect. Improved rest enhances cognitive function, emotional regulation, immune response, and metabolism, contributing significantly to the overall sense of well-being many people experience after giving up alcohol. This improvement in sleep quality represents one of the most immediately noticeable and personally meaningful benefits of alcohol abstinence. How does alcohol withdrawal differ between men and women? When it comes to alcohol withdrawal, men and women may experience similar symptoms, but their journeys through it can be quite different. You see, biology plays a powerful role. Women often have a higher fat-to-water ratio, which means alcohol stays in their system longer, intensifying withdrawal symptoms. Men, on the other hand, tend to metabolize alcohol faster, but that doesn't mean they suffer less. It just means the timeline may be shorter, not easier. Women are also more likely to experience anxiety, depression, and insomnia during withdrawal, likely due to hormonal fluctuations and brain chemistry differences. Men may show more physical symptoms like tremors and sweating, but they often underreport emotional distress, masking the psychological toll. Interestingly, studies show women are at higher risk for alcohol-related brain damage, even after consuming less over time. That means their withdrawal symptoms can escalate quicker and become more dangerous if not managed properly. Social dynamics also play a role. Women face more stigma around addiction, making them less likely to seek timely help. Men, in contrast, may delay treatment due to societal expectations of toughness, which can lead to riskier detox experiences. The body's response to alcohol cessation demonstrates remarkable resilience across multiple organ systems. From the cardiovascular benefits of reduced blood pressure and improved heart function to the liver's impressive regenerative capabilities, the positive changes are significant and measurable. Brain function improves through neuroplasticity and balanced neurotransmitter activity, while skin appearance enhances through better hydration and reduced inflammation. While the initial withdrawal period presents challenges for some individuals, particularly heavy drinkers, the subsequent health improvements provide compelling motivation for reducing or eliminating alcohol consumption. The timeline of recovery varies based on individual factors such as drinking history, overall health status, and genetics, but positive changes begin remarkably quickly and continue to accumulate with sustained abstinence. For those considering reducing their alcohol consumption or abstaining completely, understanding these bodily improvements can provide encouragement during the adjustment period. Please check out our next video above. See you shortly in the next video. Healthcare providers and support groups can offer valuable assistance during this transition, helping to maximize the benefits of an alcohol-free or reduced alcohol lifestyle.